Good afternoon, everyone, and welcome to the first day of ChristianaCare's Men's Health Week. All week long, we'll be talking about men's health topics, and today we're discussing the importance of primary care. We're joined by Dr. David Lainoff, primary care physician from ChristianaCare Primary Care at Concord, where he comes to us live right now. Dr. Lainoff, thank you so much for joining us. Please take a minute to introduce yourself.
Hi, my pleasure. My name is Dr. David Lainoff. I'm an internal medicine physician, been practicing for, I'll just say, over 20 years. Some of it I originally started in upstate New York after completing my training, medical school and residency, and then moved down to the Pennsylvania area, worked in another position for about 15 years and have been with Christiana for the last 2.
Fantastic. Welcome to ChristianaCare. We hope you're loving it so far in these 2 years. Let's start big picture. Why is it so important for men to have a relationship with a primary care provider?
So it's really important for men and people in general to have a relationship with a primary care clinician to really have what we call a medical home. So that's a place to touch base and to establish care. And some of the things that we do for healthy people would be, to talk about preventive care, to make sure they're doing things to stay healthy, such as maintaining, a good weight, eating a healthy diet, making sure that they're up to date on their screening tests and immunizations. But then, even for healthy people who we may not need to see that often, there are things that come up when they get sick. They have a sinus infection, an ear infection, a cough, or something like that. They hurt themselves at work or doing a sport, and then they need to see somebody. And if you're not established, sometimes people end up using the emergency room or an urgent care facility, and that's much more expensive. It's less convenient, and it's not something that's easy to follow over time. So it's really good to establish those connections so that when things come up, even for those without chronic disease or something that we're following on a regular basis, it's important to have that relationship established so that we're here for you when those needs arise.
And is there a certain age that should be established? Is it really age out of the pediatrician and go right to regular primary care?
Right. They age out of pediatrics and can come to us. Some of my partners here at Concord, in fact, most of them are both board certified in internal medicine and pediatrics. So they could continue seeing their patients. But for me, I just see adults, and for other adult primary care physicians, it's as soon as they age out. A lot of the immunization stuff is done, but there's still other things that need to be done for college or work, just establishing a connection so that when the need arises, even though there may not be a chronic disease that needs to be followed or a particular screening that needs to occur at that age, it's good to continue on with that care.
You mentioned immunizations. There are still shots you do get as an adult. We are right in the middle of flu season and, of course, COVID vaccine as well. So talk about what vaccinations, immunizations you would get as an adult in primary care.
So as an adult, you still get your tetanus updated every 10 years. And at least once it should be the Tdap, so the whooping cough, and that typically would occur around the time that your spouse is having children, because when they're born, they're very much at risk because they can't be immunized until they're a bit older. So that's often the time that we capture those adults for that one extra time. Other than that, it's just the tetanus. The yearly flu shot, everybody over 6 months should have the flu vaccine. And as people age and they get to be above 65, there's a special version of the flu vaccine, the high dose flu vaccine, which is what we give people. The COVID vaccination, of course, everybody should get that. And then if they qualify, and many do, they should get the booster as well. Other immunizations would be the shingles vaccine. There's the new version, where it's not so new anymore, but it's called Shingrix. It's a series of 2 shots, and then the second one is followed in 2 to 6 months after that. And that's recommended for anybody above the age of 50, although at times we don't often really start recommending it till they're closer to 60. And that is even if you've gotten the old shingles vaccine, the Zostavax, and even if you've had shingles, it's still recommended that you get the new shingles vaccine. And then lastly, there's the pneumococcal vaccination. There's the Pneumovax, and then there was a version called Prevnar, which is still available. For a period of time, we were recommending both. Now we're kind of leaning more towards the Pneumovax vaccination once after the age of 65. And if you had it before the age of 65, because you have a chronic disease such as diabetes or lung disease, you would get it once before 65 and then once after 65.
All important vaccinations, absolutely. You can also do a lot of preventative screenings in primary care. What preventative screenings are you currently doing with your patients, and why are they so important?
So we screen for many things. One thing is we always look at the weight. We look at what's called the BMI, the body mass index. There's a normal range recommended between 18 and 24. And there's a little leeway because we really take into account the people's frame size, how muscular they are, whether they have bigger bones or whether they have a small frame, but generally kind of stick around those goals. And if you're above, 25 to 30, you're considered overweight. And if you're above 30, then it's considered more than overweight. And so we talk to people about their weight and what they can do to maintain it in a healthy, at a healthy number, such as diet primarily, and of course, exercise as well. We check people's blood pressure. So the recommended goal blood pressure is less than 130/80, and that's for pretty much everybody. It doesn't mean that we start treatment if somebody's above 130/80. Typically, in people without other health issues, 140/90 is the kind of trigger to consider treatment. But there are some people in a higher risk categories where we would start when it starts to get above 130/80, and that would be our treatment goal. We screen for cholesterol, so the lipid panel, and that is total cholesterol, triglycerides, HDL, what people think of as the good cholesterol, and LDL, what people think of as the bad cholesterol. And it's not so much your actual number that is always so critical, but it's your number in relation to your risk factors. So how old are you? Men, of course, are at slightly higher risk than women. Smokers are higher risk. People with diabetes are higher risk, and people with hypertension. So all of those things factor into a risk score that we use, and then we'll be able to tell the patient whether, what their 10-year risk of a cardiac event is and what their lifetime risk. And then together, we work to make decisions about whether treatment is needed. We also screen for depression, and in patients, we use a screening tool. In patients as they get older, we screen for cognition. So are there any signs of memory disturbance? And we also screen for safety with walking. And then there's the cancer screening. And for men, that's primarily going to be colon cancer screening and prostate cancer screening. For colon cancer screening, we recommend a colonoscopy, because the good thing about a colonoscopy is that if it's normal, we only have to do it every 10 years, whereas the other tests they need to be done more frequently. So there's the old stool test, the FIT test, which is yearly, and then there's something called Cologuard, which is every 3 years, and there's a variety of tests. Of course, the test that's recommended is the test that people will do, so we'll work with people to help choose the test that they want to get done. The thing I'll say about colonoscopy is that colon cancer develops from precancerous polyps. And during the colonoscopy, the polyps are able to be removed. And so by removing a precancerous polyp, you're preventing that polyp from developing cancer. So it's not only a screening test, but it can also be a therapeutic maneuver as well. And then for and for colon cancer, the recommendation was to start at age 50 unless there's a higher risk. That's recently been updated to start at age 45. Some of the insurance companies haven't quite caught up to that yet. So we always tell people, check with your insurance first. It's not a crisis that it get done when you're age 45. So if we need to wait a year until, it's a covered benefit, that's fine. But if they're higher risk, certainly, and fall into the category where we would screen at a younger age, we would go ahead and get that done. But we are recommending age 45 and above for colon cancer screening. For prostate cancer screening, there's a little bit more controversy around the benefits of that. And but I think the recommendation is to at least have a discussion about it. So we discuss what the options are for prostate cancer screening, which at this point is primarily a blood test, the PSA, starting at age 50, age 45 for people at higher risk, and then continuing usually till age 70. So we have a discussion about what the test is, what we would do with the results, and whether they want to have that done. And so that's something that we do for screening.
Certainly, I'm sure to those watching sounds like a lot of information, but that's why it's important to have that relationship with your primary care provider, right? To kind of walk you through all of that.
That's right. The annual physical exam, I think the value of it, and it's not always annual, based on your age. The annual exam really, considering age, should start around age 50. A little less frequently prior to that in the 40s, could be annual, but could be every other year. And in the younger till about, 39, it could be every several years if you're healthy and have or otherwise no health problems. But the real important part about the exam is not really the exam itself, but the discussion of the different things that need to be addressed, such as all of these screening recommendations. Of course, as you're younger, there's a little less to discuss, but as you get older, there's a lot more to discuss. And also by then, people have often developed other issues, such as high blood pressure or, emphysema or chronic musculoskeletal issues that need to be, addressed on an ongoing basis.
Sometimes during those appointments, you're not always just seeing the provider. We did get a comment prior to this conversation from one of our viewers commenting on the fact that sometimes he'll see a physician assistant or a nurse practitioner. Talk a little bit about those caregivers in your practice and how they're also able to help the patients that come into Concord.
Right. I think a lot of practices, they work in a sort of a team structure. So we're linked with a physician assistant or a nurse practitioner as part of the team. Because, we're not always available to take care of our patients. Even if we're in the office, the schedule could be completely booked, but someone needs to be seen. And so sometimes I may see a partner's patient, sometimes someone may see one of my patients. So we work together as a team to take care of those patients. So the physician's assistant and the nurse practitioner are very qualified to take care of our population. They're sometimes we work to see each other's patients. Sometimes, and they also have their own panel of patients that they follow as well.
And what about specialists? Some people may be watching saying, I already see a cardiologist or another provider, so I'm sure I'm fine. They'd check on me if I wasn't. But there's a relationship building there between primary care and specialty as well.
Right. Specialists are great. They have a terrific fund of knowledge and a level of expertise in areas that, we don't. We're generalists. So we know, I guess a lot about a lot of things. They know a lot more about specific things. They also are the ones who will do any procedures, which we can't do. So we work together with our specialists. So if somebody has a specialist, say a cardiologist or a pulmonary doctor, especially if they're in Christiana system, we share the same electronic record, so we can communicate just by seeing each other's notes. We also can message each other. We even have a text-like messaging service where we can ask questions of each other. and we can communicate that way to help take care of the patients. So while the cardiologist may be focusing on the patient's, congestive heart failure, or maybe they have atrial fibrillation, there may be some other issues that they see during their visits that they recognize that, we need to see the primary care doctor would be better to address that. And sometimes if we have patients that are seeing multiple specialists, it could be a bit overwhelming for them to keep everything on track. And I think one of our jobs in primary care is to help get the information that they're from the specialists, and act as kind of the captain of the ship of their care, so that they are very clear about what's going on between the different specialties, and that we don't have competing things or sometimes evaluations that somebody recommends that may have already been done, but they didn't know about. So it's important for us to keep on top of that. And we also will offer, if somebody's seeing a specialist, say multiple specialists multiple times per year, we'll say, well, let's take a step back and see what we're getting out of those appointments, because sometimes we can help work together to all kind of cut down the total number of visits that somebody has. We can do things such as alternating visits between the specialist and primary care, so they're not seeing everybody the same month and then nobody for 3 months, or maybe they don't need to see that many visits at all. So we can work together and say, well, I can take care of this issue. And we've done this, people that are stable after a period of time, communicate with the specialist, and they'll say, you know what, there's no more evaluation that needs to be done. This patient's been pretty stable on the treatment that they have, and I don't need to see them as often, or maybe I don't need to see them at all, but that they know that they're available to them and they're available to us, that we can get them back into care if needed. So it's all about trying to coordinate that care and do it in a way that, uses makes it the most convenient for the patient, which sometimes means seeing people less often rather than more often.
And certainly one of the perks of being a ChristianaCare patient is having that connection to care. No matter who you're seeing within ChristianaCare, they're able to then communicate across the health system. So that's certainly an important point to make. Dr. Lainoff, what do you think is the biggest takeaway you want patients to understand from our conversation today?
Well, I want them to remember the importance of having a primary care provider, and that really it is a good place to establish care, hopefully before you have the real need related to a specific illness, because we can save you time. If you have a good relationship with a primary care provider and you call because you're sick, there are things that we can take care of over the phone. There are things that, we're now doing more telemedicine as well. So it can be much more convenient than if you try to, get care for an urgent or, semi-urgent issue that kind of pops up and you don't have an established connection with any practice. Then you're kind of left with going to an urgent care, and then you have to follow up anyway, right? The next thing they'll always say is that you should see a primary care clinician after the visit. So I think that's one reason. But the other thing is there's lots to stay on top of when it comes to screening and good health habits and immunizations, and and we can help with that. And then of course, our bread and butter is to treat chronic disease that's very prevalent. Many people have hypertension. Many people have high cholesterol, diabetes, chronic lung disease. And we're very comfortable treating all of those things. And we're also very comfortable realizing when we need help. And then we're able to reach out and use our specialty colleagues. But I think it's a great place for people to start their care, coordinate their care. And, our goal is to try to, maintain health, and when there are health issues, to manage them as best we can.
And if someone watching right now would like to be your patient, or just a patient in general at ChristianaCare Primary Care at Concord, where can they find more information? How can they do that?
Well, I probably connected to this broadcast. We'll have that information, but you can also look on the ChristianaCare website, and there's a Find a Doctor location, and it gives you many options, what kind of doctor you want, male or female, location. And then a lot of us actually have little introductory videos So you can even get a sense of what the people are like as you're choosing. So and Concord, our location, we currently have let me see, 1, 2, 3 or 4 other doctors. I think we're getting another one next week, and we have two physician's assistants, and I think we're getting another one next week. We're in a geographic area of growth, and the practice has grown very nicely. We have a group of terrific clinicians here, and we'd be very happy to take on new patients. And the facility is great also in that it has X-ray. So it's got regular X-ray, it's got a CAT scan, an MRI, and a mammography. So, and then we also have specialists that are here as well. They're not here every day. Some of them are. Sports medicine here is here almost every day. Women's health is right upstairs. So if women need to see a gynecologist. And then, as I said, my partners are also pediatricians. So they can take care of the whole family. So they can take care of both children and adults. And then we have urology here, urogynecology. We have hematology. We have a little bit of physical therapy and a blood bank. And I'm sure I've forgotten some people, but it's growing. It's a great location, very easy parking in and out. And there's a lot to offer at this location, as other Christiana locations as well. And we're all licensed both in Pennsylvania and Delaware. So there's no issues with prescriptions or any other things.
Absolutely. And anyone watching this live on Facebook can click on the link in the comments directly to Concord and get the phone number and more information about what's available on that campus up in Glen Mills. Well, Dr. Lainoff, thank you so much for your time today. Definitely important information about having a primary care provider. And if you're watching, stay tuned tomorrow for day 2 of Men's Health Week here at ChristianaCare. We'll be talking to Dr. Shah about urology. Thank you so much and have a great afternoon.